The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views and positions of the agency.
Welcome to DYCD Next Gen. Once again, I'm your host, Ryan Cooks. Our monthly podcast features the very latest in everything DYCD has to offer, and we go right to the heart of the story, speaking to young people in New Yorkers about the issues they face in their daily lives. May is Mental Health Awareness Month, and we're honored to have Rachel Martin, who is the Chief Operating Officer from the Born This Way Foundation, joining us today. Welcome to the show.
Thanks so much for having me, Ryan.
Thank you. And in this episode, we're going to be talking about the organization, the incredible mission behind supporting and empowering young people through mental health resources, kindness, and community, and why creating safe spaces for youth matters now more than ever. And we'll also dive a bit into the Be There Certificate, which is a new free program designed to help people feel more confident supporting friends, classmates, coworkers, and loved ones through mental health challenges. So, Rachel, for listeners who may not be familiar with the Born This Way Foundation, can you explain what the organization is and what inspired its creation? And also maybe give a bit about yourself and what you do at the organization as well.
Absolutely. So Born This Way Foundation was founded almost 15 years ago now by Lady Gaga and her mom, Cynthia Germanotta. And their vision was to build a kinder, braver world for and with young people. And mental health and wellness has always been a really important component of that mission. So our work focuses on a few key areas. So first, we want to work directly with young people to elevate their voices, to connect them with community and inspire them to take action. So we have a storytelling platform called Channel Kindness. We host a lot of intergenerational community events, work like that. We then also, once we hopefully have young people's attention, we want to connect them with resources. So we have Be There Certificate, which you mentioned, and I'm excited to talk more about that in a minute. And then we also work directly with young people to identify community-based organizations to provide funding to. So our grant-making program is called the Kindness and Community Fund. And right now we have 55 incredible organizations across 11 countries that work directly with young people to provide them with the resources and the support that they need. And then lastly, we do a whole bunch of research directly with young people to make sure we are being led by young people and the data around what is going to be most effective to support a young person's wellness.
That's amazing. That's amazing. And how long has when did it start, this foundation again?
2012. So next year is going to be 15 years.
15. Wow.
Yeah.
That's incredible. And I know the foundation talks a lot about building a kinder and braver world. What does that phrase mean in practice when it comes to supporting young people's mental health?
Yeah, I think this is one of the challenging and amazing things about kindness, right? When we talk about kindness, because it can mean so many different things to so many different people. And we definitely want to leave space for that. But if I had to give you my definition, I always think about sort of three component parts of a kinder, braver world. And what we want kind communities to look like. So first is making sure young people and the rest of us have third spaces, right? Have places that we can go to be in community with one another, to explore our interests and pieces of our identity, and be able to do that in person with one another. Second, our access to caring adults who are going to listen directly to young people and provide them support that meets them where they are. And then third is peer support, right? Being able to care and show up for one another in the ways that we actually need and want, and is going to look different for everyone. So I think those are some of the component parts we think about when we're thinking about building kind communities.
Yeah, so we know that youth mental health is an important focus for your organization right now, especially with like a lot of what's going on in the world and how it's affecting, Generation Z and the generations after it and everything. So why is it so important for your organization to focus on these social issues?
Yeah, absolutely. So I think mental health and wellness is something that is so critical because it's something each of us is going to experience throughout the course of our lives. And it's also going to touch everything else that we do, right? So if we care about education, we need to care about mental health and wellness. If we care about physical health and wellness, we need to care about mental health and wellness. And so on and so on and so on, right? It is this issue that touches so many other components of our lives and is touched by so many other components of our lives. So, thinking about mental health and wellness as something that if we focus on and if we get right more often, so many other component parts of individuals' wellness will improve, but also how our communities function will get easier as well.
That's great. And I was doing some more research on your foundation, and one thing I love about you guys' work is the idea that kindness and mental health are well connected. And I feel, I mean, from when I see it, this generation, just like a lot of negativity, and it just doesn't, I feel like just like everything that's going on, people don't feel the need to be as kind or be supportive of each other. So I just want to ask you, can you talk about a bit about how can kindness generally impact somebody's well-being?
Yeah, absolutely. It's incredible, right? Because it's this thing, kindness, that seems so obvious and so basic. I think it's actually really easy to overlook that how we treat each other, and again, it sounds obvious, but how we
Yeah.
treat each other has really profound
Right.
impacts on, again, like how we function together as groups of humans, but also how we experience the world as individuals. So we have done a whole bunch of research on this intersection between kindness and wellness. And again, spoiler alert, unsurprisingly, young people who report being in kinder communities report better mental health outcomes. I think the other way you can think about this issue is how the World Health Organization would describe this, right? And they, right now, excitingly, are talking a lot about the importance of social connection as kind of like the phrase that they would use, but it's basically the same thing, right? It is how are we showing up for each other and building strong ties between each other as humans that is going to impact all of these other areas of our life and make sure that we're able to, again, show up for each other and show up for ourselves in important ways that will impact our mental wellness, our physical wellness, and so much about how our communities function together. And that's kindness. It's just said in different words.
Right. Exactly. Yeah. That was really well said. And what are some of the biggest challenges you feel that young people are currently facing when it comes to mental health and like asking for support? I know that's not easy for a lot of the youth to reach out or like be vulnerable with other
Yeah.
people. So how do you feel about that?
Yeah, absolutely. And I'd be curious how you would answer this question and what you hear from your peers. Some of the things that we often hear on our end is one, and this is in no particular order, right? But I feel like common themes, especially post-COVID, that I hear from a lot of young people are, again, going back to that desire for more third spaces, to use the wonky term, right? To have more opportunity to connect in community with one another. And I think a lot of the conversation ends up sort of going to digital media, right? And oh, young people are on their phones too much. And I think we're often missing that some of that is being driven by a lack of better alternatives, right? Young people not having other places to go, especially outside of home and outside of school. So that strong desire for more access to community in real life is definitely something we hear a lot about. I would definitely also say like a huge persistent concern we hear from young people, right, is struggling to access mental health care and or not knowing where to go, right? Like we have really complex systems, right? Like the
Right.
American
Yeah.
healthcare system, infamously not easy to navigate or not easy to afford. And that all impacts, right? Like being able to, especially for a young person, access forms of mental health care that could be really transformative for them.
I'm just curious, do you think it's also an issue when it comes to like lack of third spaces and everything? Do you think it's an issue of like kids not having the financial resource or not having enough money
Oh,
to do what they have like
yeah, exactly. 100%, right? Like Being out in the world for most of us, again, especially outside of home, outside of either school or work, so many of the alternative options we would have are places that involve having to have money, right?
Right.
Like, I am of an age, like the formative third space for me when I was a teenager and a young adult was the mall. And one, oftentimes, like malls don't exist in quite the same way, but even if they do, you are only welcome there often if you can be spending money in those places. So this is something we think a lot about. And one of the reasons we fund those community organizations is because they are often able to provide these third spaces, right? Whether it is a arts or poetry organization or an organization that is doing sports and athletics, or just like a community center where young people can go and hang out and they don't have to spend any money for the privilege.
Yeah, because I was just really curious, but I'm like a lot of like kids today, I feel like they want to have these third spaces and they want to go to these certain events and places. They just don't have the money or like methods of transportation. It's just like
Yeah.
there's so many factors that play into it. It's just crazy to me, like parenting and everything. Like it's insane.
Yeah, absolutely. Just the basics of like transportation, right? And like how wild that like how our transportation system works is also something that then ends up impacting our mental and physical wellness, right? Like
Right, right.
if you, especially outside of New York, right? Like if you need a car to get someplace, then you are going to be really limited if you don't have access to that, which a lot of young people aren't going to. And then we also know, and again, I'm based here in Brooklyn. I'm down the street from Atlantic Terminal, which, unless they've changed it in the past few months, is also a place that actively does not welcome teens in the after school hours, right? So we also have this element of like, we're not always making the options that do exist. We're actively preventing young people from accessing these spaces instead of coming up with better solutions.
Yeah, for sure. It's something I really like. I think about a lot. I feel like when I was younger, like I had access to like a lot of programs and stuff as a kid.
Hmm.
I just seen this generation, like they don't really have as much access as I have when it comes to these programs and things to do. And it's just so many factors that come into play. So thank you for that. Yeah. Like I just needed to like understand like what were the reasons and everything.
Yeah, and I
So,
think there's so many reasons, and I think that's one of the reasons why it's then hard to think about good solutions. But a lot of it comes down to like we just need to be funding these places, or one, we need to be listening to young people to understand what they want these places to look like, and then we ha actually have to fund them, right, so that they
right.
can exist, and then we have to
Right.
make sure young people have a practical way to get to and from that is like safe and convenient, and we'll make sure they're able to go to those places.
Exactly. And my next question to you is a lot of young people, sometimes a lot of young people, they turn to their friends instead of a professional when they're struggling or going through something. So how does the foundation help prepare young people to support one another safely in a safe way?
Absolutely. So this is where Be There certificate comes in. And you're totally right. Young people, like all of us, if you are having a hard time, uh, it is very likely that you're going to talk to a friend about that, or a friend is going to be the first person who's able to notice that something might be going on before you talk to your mom or talk to a doctor or talk to somebody else, right? So friends are this really important first line of defense. And we know young people want to be showing up for each other. It is not from like a lack of desire, but it's hard if you one haven't necessarily seen this modeled, right? How do you actually provide support effectively? And nobody's ever taught you how to do it. So that's where Be There certificate comes in. So it is totally free. You just need an internet connected device. You go to betherecertificate.org, and it takes you through 5 golden rules to help you learn how to spot the signs somebody in your life might be struggling, and then how to actually have that supportive conversation with them in a way that is going to be appropriate to sort of honoring your really important role as a friend, but not try to make you into the therapist or the clinician, right? But you can instead, again, be that really, really important person who listens, who hears, and then helps bridge to other forms of support if you need it.
could you walk us through the five golden rules if possible and like why they are so effective?
Yeah,
Yeah.
absolutely. And they're going to all seem pretty straightforward. And that's kind of the point, right? Because part
Right.
of this is understanding that these conversations actually don't need to be super complicated. It's just about knowing sort of like a couple best practices. So the first golden rule is say what you see. So helping somebody do the like pattern recognition around a behavior or a pattern that you've seen that you think might be a sign something is up, right? So really using this step to understand the difference between a friend who's, oh, like that person's just being flaky and understanding like, oh no, maybe there's something more here going on and letting the person know what you're observing in case that in fact is the sign that something else deeper is going on. Second, show that you care, right? Just like what are the small gestures to indicate that you are on their team, that you are looking to support them. Third, and this is the one I feel like especially adults who earn their Be There certificate often are a little surprised by or struggle with, but it's hear them out. So basically, the idea that your job is to listen, it is not to fix. Nobody in the situation needs you to offer the like 5 point plan for how to fix their problem,
Right.
right? That doesn't tend to make anybody feel heard or supported. So instead, truly just actively listening so that they know you're there. Uh, Fourth, know your role, right? So going to this idea around like you are the friend, you are the loved one, you are the peer, you are not the clinician, and you don't need to be. Which then goes to the last rule around, or yeah, the last golden rule around connecting to help, right? So if the person is in fact struggling, if they're at a point where they want to access other resources, walking you through how to help be that bridge to those other resources.
Aside from the beater certificate and the foundation itself, for listeners who want to get involved or support mental health in their own communities, what do you think is the best first step that they can take after listening to this episode?
Yeah. I mean, so you said besides Be There certificate, but I will plug in once again as truly if you've got, it just takes 90 minutes. So if you have a couple of hours, and it's totally self-paced, you don't have to do it in one sitting. You can come back to it. It's available in English, French, and Spanish at betherecertificate.org. So definitely as just like one foundational thing, definitely earn your Be There certificate. A great knock-on effect is like you will then also, because you're learning more about mental health and what it looks like in practice, you'll also be better able to take care of your own mental health because you'll know what to look out for in somebody else. So you'll also be able to understand more about your own wellness at the same time. So earn your Be There certificate, number one. The second thing I would encourage if you are somebody who is looking for more opportunities to support mental wellness in your own life or in your own community is to think about that social connection piece. Or again, kindness or social connection, whichever words you want to choose,
Right.
right? And this is where it's going to look completely different for everybody, right? So in my life, a thing I really prioritize is carving out dedicated time every week where I spend time after work with my friends. And that is something that I make sure to manage the logistics of, which sounds not like a mental health thing, but it is how I'm able to spend time in person with humans who I care about, who care about me. So finding those opportunities and really prioritizing that, even when it can be, again, like we talked about, complicated if you don't have easy access to places to go or things that don't cost money to do, right? Or the transportation is difficult. Still prioritizing those opportunities to be in person together with people that you care about, who care about you, and fostering those relationships is going to be something that will have really important impacts for your wellness, for their wellness, and again, like how whole communities are able to function better together.
What gives you hope when you look at the future of youth mental health?
Oh man, I know it sounds trite, but the answer is young people. Like last week, we got to be in DC at a community event that we hosted. Again, we try to practice what we preach and like create those in-person spaces when we're able to as well. And we had a room of 125 people, about half were under the age of 24. And whenever I'm privileged enough to get to be in a room like that and hear directly from young people and what their ideas are and their passion and energy and hope, that is the thing that always gives me like the best realignment for how I'm thinking about the
Right,
world
right.
when it can feel really heavy. And being directly in community with young people, I think always recenters my priorities and reminds me that actually there is like a ton of really amazing stuff going on every day. And young people have a ton of ideas about how to move solutions forward. And if we focus more on that, we're going to fix problems way faster.
And if you don't mind me asking, because I'm a bit curious.
Mhm.
What made you get into this line of work?
Oh, yeah. Always a fun question. So I didn't go looking for it. I had actually, I'm not originally from New York, but I moved here back in 2013 to work on a campaign. And then I ended up working in City Hall for a couple of months. And it was both incredible. And it was also when I learned like that was not going to be my journey. And I was lucky enough that like as I was realizing that wasn't the door I was supposed to walk through.
Yeah, yeah.
Another door opened and it led me to Born This Way Foundation and this work. And sometimes things just work out.
Okay, great. Yes, you just found yourself here, and now like you enjoy what you do, and you're happy, and that's great.
Exactly. Yeah. Sometimes, yes, you can't plan for everything, and it's just about like keeping an eye on the opportunities as they present themselves. And yeah, I was really fortunate. This was the door the universe opened for me.
Absolutely. Yeah, that concludes our episode. Is there anything else you would like to say to our viewers? Any information that you would like to give or anything?
No, just thank you again for what like such a wonderful conversation and some really insightful questions. And again, the my my always and forever plug is to go to BeThereCertificate.org and earn your Be There certificate.
Okay, great, great. Thank you so much. For more information on DYCD, check out nyc.gov/DYCD, or be sure to follow us on Instagram, Facebook, X, YouTube, and LinkedIn. And join us again next month for another episode of DYCD Next Gen. Once again, I'm your host, Ryan Cooks. Thank you for listening, and we'll see you in the next one. And thank you, Rachel, for doing the show. Thank you so much.
Thank you so much, Ryan. This was wonderful.